Welcome and thank you for joining us for this Facebook Live media conference. Today's presenters are Mr. John Canosa, Director of Public Health for Clinton County, and Dr. Keith Collins, CVPH Infectious Disease Specialist. Each will provide brief updates, and we will do our best to then respond to your questions. Since we do anticipate some duplicate questions on the same topic, please listen carefully as the responses to your questions may be put together with some other questions that are being answered by our speakers today. We also have with us Mr. Eric Day from the Office of Emergency Services, who will help with responding to questions as needed. An additional note, we anticipate that we'll be able to provide a closed caption version later in the day on YouTube, so please check our Facebook page and you will also be able to find this Facebook Live on YouTube. Thank you, and at this point I invite Mr. Canosa to the podium.
Thank you, Karen. Take this off so I can talk reasonably well. My name is John Canosa. I serve Clinton County as the Director of Public Health. Good morning, everybody. As I try to often do, first, I will give you a numbers rundown of our cases. As of today, Friday, May 1st, we have one new case since yesterday. We have a total, thus, of 65 lab-confirmed COVID-19 positive cases in Clinton County. 53 of those 65 cases are now recovered. That's a solid number to remember. Thus far, in Clinton County, we have 748 total tested people. We also have 40 suspect cases that we've been tracking all along. However, we have 40 of those 40 cases have now recovered. So that's another solid number to remember. There are a few topics that have generated questions and concerns this week. They are specifically reopening businesses, services and recreational areas, antibody testing, and testing in general. I will speak briefly this morning about some of the planning efforts and thoughts and thinking that we have moving forward around safely reopening the county, and how the department is currently focusing on our efforts in this regard. As you're probably aware, New York State is in the process and is completing final preparation of general guidance for reopening of the whole state. As that becomes more specific, we will have a clearer picture of exactly what that means for Clinton County and the North Country as well. In the meantime, this is what I can say. Most importantly, protecting the health and well-being of the residents of Clinton County is now and always has been the mission of our Clinton County Health Department, and this remains our primary focus. There are many sectors of our community that will need to be looked at individually to identify and determine the safest path forward. CCHD has always been had a specific role in that regard in opening up each of our sectors of our economy. Clinton County will speak loudly and often on behalf of protecting the health and safety of our residents. Please know that. On the recreational side of things, let's first talk about campgrounds. We have heard from people in the last few weeks who spend a good part of their time living in the North Country during the warmer months, while they spend the colder months down in southern states. This is their home, accordingly, for half the year. And they are getting ready to return home and or are returning home as we speak to campgrounds, RV parks. These campgrounds and parks are allowed to open as of today. Not all will open immediately. Most of our parks open around the 15th of May, typically just before Memorial Day in May. But they can, if they choose to, they can open. CCHD has provided the operators of these campgrounds with guidance for how to do so safely as possible, including campground operators giving them guidance on social distancing, increasing cleaning of their facilities and disinfecting, and also for their clientele, the patrons who come to their campgrounds to camp, recommendations for them to socially distance and also maintain separation from other family members. From other patrons at the campground. You want to be close to your family. CCHD will continue to remind the public of their responsibility in this regard too. Each of us, be mindful, is responsible for maintaining a physical distance from anyone who is not in our household. And when you are in the public, you want to keep some separation distance between them. In any situation that distance cannot be where appropriate social distancing cannot be maintained, please be mindful to wear a mask. Restaurants and other food establishments, as you probably know, the Clinton County Health Department permits local restaurants, food service establishments, and those restaurants cannot operate without a permit. Therefore, we maintain very close contact with all of our food service establishments, and this connection, I believe, will serve very well for us in the future, the near future, when restaurants are looking to open as directed by New York State. Further, there's also a regional effort to coordinate some of our efforts for safe reopening of our counties. We are working with public health directors from other local North Country counties to develop a general guidance, a general plan of attack for opening each of our counties. We want to generally be all on the same page with respect to safe opening. Our goal is to develop a unified guidance for our elected officials as plans for reopening are discussed and options are weighed in the upcoming weeks. Testing. Lastly, I will touch on testing in Clinton County, and then I will turn the podium over to Dr. Collins, who will include some discussion on antibody testing in his remarks. As of this morning, as I mentioned, we have 748 positive, COVID positive diagnostic tests have been conducted for Clinton County residents. Of those, we have 65 positive cases of COVID, 65 of 748. This represents a very small percentage of our population. However, there are a few things to keep in mind about testing. As Dr. Collins and his peers have stated in the past, testing is not treatment. Those in our community with COVID-19 who need treatment are receiving care, and anyone who needs level of care that requires hospitalization is being tested and has been from the start. Testing capacity has increased in the last week or so, maybe last week and a half. Testing numbers that are being reported for the North Country cannot necessarily be compared to that of our neighboring states. Numbers that are shared by the media for Vermont, New Hampshire, are state numbers. The percentage of residents tested in Clinton County as compared to other rural counties in New York is similar. And while it is lower than most people would want, we are not alone in the minimal number of testing that has been completed. In closing, we are seeing the light at the end of the tunnel, and this is a good thing. We're seeing the opening coming up soon. Please don't forget in this time all that you have learned over the last couple of months of a lot of hard work, a lot of self-sacrifice. Stay strong. More importantly, stay smart, keep up social distancing, keep up solid personal hygiene, and wear a mask when you're out in public when there's a good high chance that you're going to be in close proximity to other people. With that being said, I want to turn the floor over to Dr. Collins. Thank you.
Thank you, John. I appreciate it. And thank you for having me back. Before I get started, I want to do what I always do here, which is to thank again our nursing staff at our hospital and our environmental services staff, as well as our emergency department staff, because they truly have been on the front lines, and I think they've done an incredible job. I would want to give you guys a little bit of update on how we are in the hospital now. To my knowledge of this morning, we only have 3 patients that are still hospitalized, all 3 of which are improving, all 3 of which are not in the ICU. One of them was and has been moved out. They're doing better. So that, I think, is good news for us. And I also think that the reason that we are seeing, I should point out, we are seeing a decline in the number of cases that are coming to the hospital now. And I think that's a combination mainly of really good social distancing and the fact that we are a rural county. But I want to commend everyone out there that I think you've done your job. I think we would have been a lot worse off had it not been the fact that you really did do social distancing. And I think you should be also congratulated for the job you've done at home. And that's an important thing that I think we don't want to overlook here. As far as testing goes, I think there's two things. I've been asked to talk about antibody testing, which I'll do, but I just want to back up for a second and talk about testing in general, because I think people need to understand there are basically two different kinds of tests that we are talking about here. The first is the kind you probably already know about, which is where we do the nasopharyngeal swab for COVID-19. That's actually looking for the RNA of the virus, the genetic fingerprint of the virus. So it's looking for a piece of the virus. And that tells us who actually we think has COVID-19, that has symptoms when we do that test. So that's looking for the actual virus itself, and that's when we talked about testing all these last month and a half, that's what we've been talking about. And that's what we have been short supply nationally, and we all know that we've been in short supply here in Clinton County. Things are getting better in the standpoint of testing. Our hospitalists, by next week, will be testing people that are anyone basically symptomatic with a doctor's order that needs to be tested. That's a change from what we've been able to do, and I'm happy to hear that. We still aren't to the point where we can test everybody that we might want to test, but we are going to be able to test anybody that's symptomatic. I think when I've been here before, we've talked about the fact that if you're feeling ill, stay home and ride it out. Again, that's I'm not saying that that's still wrong to do, but now your doctor would be able to order a test if they thought you needed one, and you could get a test now. So that's a change since the last time I've been here. That's because we've gotten more testing. Again, the testing I'm talking about is looking for the actual virus. The other type of testing that is now coming up, and I think you're going to be hearing more about in the coming month, is antibody testing. And that is a slightly different goal than what the testing we've been doing. With an antibody test, you're looking to see who's had the virus, and not necessarily who's infected with the virus right now, but maybe who's gotten over having the virus. And that would be a great goal if we could determine actually who's had the virus and who hasn't, and that's the goal of antibody testing. At least one of the first goals of antibody testing. So you know probably that Governor Cuomo sent out antibody testing to a lot of places, here in Clinton County being one of the places. And to compare us, for instance, New York City, that when they did this antibody testing, they found about a quarter of the people in New York City had tested positive for the virus, meaning that they had had it potentially and gotten over it. Whereas around our area, it was about 1.2%, so we're much, much, much lower. And I think that that's where testing right now really can give us at least a general idea of how prevalent, how common the virus is in an area. So in our area, it's been pretty low, which I think is great. Again, we're a rural county, and I think we've done a great job in social distancing, and our numbers have stayed low. But I do want to caution people about antibody testing and explain a little bit about how it differs. So with an antibody, it's a protein that your body's immune system makes to a virus. It's not the actual virus that the test detects. It detects your immune system's response to try to fight the virus. And there are all these different kinds of antibodies. That I don't want to get too technical, but some antibodies that the immune system makes just proves that you've had the virus, but they don't stop the virus from multiplying. And so and then there are some viruses that, COVID-19 is a coronavirus. Well, there are a lot of coronaviruses that just cause common colds, and we still at this point don't know how specific the tests are we have in excluding those viruses. From what I've read about the tests that are being used now, they're somewhere around the lower to mid-90s in sensitivity, which means they'll detect the virus in about 90% or maybe 95% of people who have had it. And what you want also is it to be specific, meaning it will you'll only test positive if that's the virus you had. And so the numbers I've been hearing are somewhere around 90 to 95% sensitive and 90 to 95% specific, and specificity being maybe a little higher in some tests. So those are important, but just keep in mind that if you have a population of, say, 1 million people and 100,000 of them have or let's just say 100,000 population, and you test, and then 5% of the people you test that might actually have the virus will test negative, and the reverse is also true. So we can't totally rely on these tests to say this person definitely had it, this person definitely didn't have it, but we can get a general trend in the county and the state, which is what we are now. So we know kind of from what's been done. In general, we know New York City had more, and that's what the test showed. We know we had less here, and that's what the test showed. But I want to caution people now that antibody testing does not prove that you're immune to the virus, even if you did have it. We just don't know that yet. There's too much unknown about whether the antibody that we test for is actually going to give you immunity to the virus. Remember, I told you before, your immune system makes different antibodies to, when it sees a virus, it'll make a series of antibodies, some of which may kill the virus, which is what we want, and some of which just detect the virus, but they don't stop it from multiplying. And at this point in our science of testing, we don't know whether if you test positive, even assuming that it was from COVID-19, whether you are actually immune to that virus or whether you could get it again. So I want everyone to keep that in mind. Hopefully the case will be that you do have immunity, but we just don't know that yet. So I know some of this sounds maybe confusing, but that's just where we are at this point. There are different types of antibody tests. There are these more sophisticated ones, which hopefully once they're up and running, we'll be able to tell whether there is immunity and what level of antibody someone has to have in their bloodstream to be immune, assuming that we have immunity at all. The final thing I think before I leave antibody testing is even if it shows that if it's proven that someone is immune, we don't know how long the immunity will last and whether or not the immunity will wane or not, and whether you would have to, could then become susceptible and say 2 months, 6 months, a year, we just don't know. So there's a lot of unknowns finally about what antibody testing really is going to give us. We're going to get better, but right now I think we're to the point where we can just get a general idea of how prevalent the virus is in a given area. And thank goodness our area has been a fairly low spot. Another thing I just wanted to talk about was, as many of you have seen on the news from Dr. Fauci, that there is now remdesivir, which is a drug which is going to be used to treat COVID-19. I want to first say that no one has it yet. They're going to be ramping up to make it, and that's a great thing. And I also think the preliminary data that Dr. Fauci talked about of having shorter symptoms is a great sign that this is at least something that works against this virus. But I also want to caution you that there's nothing yet that proves it lowers mortality to the virus. Hopefully those studies are ongoing, and hopefully we'll see that that is the case. It may be a situation where if you're severely ill, it may be that the medicine may not work as well once you're severely ill, and maybe if you use the medicine when people are mild to moderately ill, you can prevent them from becoming severely ill. Those are two different groups, and they're being looked at in multiple studies to see if you're severely ill, does remdesivir work? If you're mild to moderately ill, does it stop you from getting severely ill? So that's where we are. And hopefully, I think it's very promising that we at least have something that shows it's got activity against the virus. But I want to just let everybody know it's going to be a while before we have that drug available anywhere. There is no country right now that has remdesivir available. It has not been released anywhere. The other thing I would tell you is there was a disappointing study that was stopped in China on remdesivir that did not show improvement in mortality in sick people in an ICU. So as much as I'm encouraged by what we've heard about remdesivir so far, I do want to put a note of caution out there that it's not going to be the miracle drug that we would hope to have. I think it's going to be a good thing for us to have. It's going to increase the pressure for us to test. Remember, I kept saying testing is not treatment? Well, I can't say that anymore once we have remdesivir available. But keep in mind, we're not quite there yet. But we are increasing our testing anyway, and once we have a drug that we know works, especially if it works in early or moderate disease, that's when we are going to want to really ramp up and be able to test people if it shows that that we can stop them from getting sicker. And I think with that said, that was pretty much what I wanted to cover. I'll be happy to, like John, take any questions. Thank you.
We have a few questions we're going to start with. John, I think this will be for you. What's the difference between quarantine and isolation?
Well, I could do it verbatim. However, I'm going to read out the definitions of those as per my experts here. Quarantine is for 14 days from the date of exposure, potential exposure, to see if the exposed person is going to develop symptoms and need to be isolated. Mandatory quarantine is for close contacts, while precautionary quarantine is for proximate contacts. Maybe you weren't so close. Now, isolation is for people with symptoms, and they're the sick people, symptoms. And it lasts for at least 7 days from symptom onset, plus 72 hours without a fever and without the use of a fever-reducing medications like Tylenol. Plus, symptoms must be mostly resolved. That's that definition, those two definitions for you.
Okay. Do you have any insight on when small businesses that can operate with a single employee might be able to reopen?
It depends on what part of the public, what percentage of the public they are serving. That's the big difference in how they can safely do that. We are putting together a plan right now, consistent with the directions provided by the State Department of Health and the New York State itself, to try to come up with plans for various businesses, municipalities, town offices, village offices, as well as our county offices, to open safely. So we're working in that direction this week and into next week, with plans to start meeting with some of our peers in each of the town and village offices so that they can go out from their locations in their jurisdiction to meet with the businesses to help them plan for a safe opening. I think it's coming up rapidly. Can't give a solid date on that, though.
Okay. Now, can you tell us if the trends in Clinton County are going up or down, what our trends locally look like?
The most important trend for me is cases per day. That's the key number that I look at every day. Second most important to be looked at is recovered, okay? Number recovered. I can tell you that the rate of our new cases per day are definitely down, while what's going up is the number of people recovering. So those two graphs, if you will, are intersecting very quickly. The number of new cases per day is coming down, okay? We're at a total of 65 cases right now in Clinton County, positive for COVID, okay? That's only going to go up, okay? However, the rate per day is coming down while the number of recovered cases total continues to go up, and we're loving that. So I hope I answered that question.
Thank you. Dr. Collins, a few questions for you. Do we have any capacity for local antibody testing right now, or any insight on when we might have that available?
Don't have capacity to do antibody testing on the general population yet. The only antibody testing we're currently doing, to be honest with you, through our hospital is for people who might be getting convalescent plasma. I don't know if you guys remember hearing about that, where people who have recovered, we hope, we don't know, we hope that they have some antibodies in their bloodstream that may kill the virus. Again, we don't even know if that's true, but that sort of thing was used against viruses such as Ebola and SARS-1, which is a very similar virus to this one, with some success. And so we are testing people who have been donors that have gotten over COVID-19 that are donating plasma for people that are sick. We've done one case of where we've given that plasma to a patient, and we don't know if it was coincidental or not, but they did improve and were able to come off the ventilator a couple of days later. But to get back to your question of general antibody testing for, like we're testing for COVID itself, no, we're not there yet. And I think part of the problem is normally the FDA actually approves these kinds of tests. And since we're in an emergency situation here, a lot of the normal vetting that the FDA normally does for testing that companies are releasing isn't currently possible, and they're doing what's called emergency use authorization. And this is where it gets, again, a little bit technical, but there's testing just for like what they call research. For instance, that's kind of what Governor Cuomo did. That was an idea to see for public health purposes how much COVID might be in a given area, but it's not, that same test is not designed to treat or test individual patients. It's only for public health monitoring. And so you have tests like that, and then you have tests where eventually doctors will be able to use the test in whatever capacity that it might be useful to treat patients, and we do not have those tests yet. So I know that's kind of a long answer to a very simple question, but that's where we are.
Can you speak to the criteria for starting to do elective surgeries as it pertains to CVPH?
Not really, I can't give you all the details. I can tell you that we've already come up with a positive to do urgent surgeries. And that, the definition of that is, again, I'm not a surgeon, so I don't want to try to speak directly to what considers urgent versus elective. But I can tell you that I think our county and our hospital meets criteria for us to start doing elective surgeries. And our hospital is in the process of requesting a waiver from New York State to allow us to begin doing elective surgeries. Hopefully that will happen soon, but I don't really know how soon that will be. But we meet a lot of criteria for us to be able to do elective surgeries, meaning that our case rate has been falling, and we have the staff available to in our hospital to be able to do those things. But we have to get a waiver from the state of New York, is my understanding, for us to start doing that, and our hospital is applying for it.
Okay, thank you. John, again, this last one for you here. Do you have any information you can share on the decision to reopen schools?
Well, I've been in pretty close contact with Dr. Davey, at least a few times every week, talking with him. Regarding schools, the word is that the Governor Cuomo will be talking about this subject matter today, as I understand, probably very soon. We do not have Dr. Davey from Champlain Valley Educational Services here today, but we will be touching base with him probably this afternoon, as early as this afternoon, after the governor puts out his presentation speech this afternoon. So, and when we have that, we will certainly, we get that information from both the governor and Dr. Davey, we will certainly share that with the public.
Thank you. That concludes today's media conference. We hope that we have answered your questions, and we appreciate you taking the time to be with us this morning. Thank you to our speakers.